Welcome to the deep dive. Okay, so today our mission is really to decode something pretty dense, but absolutely critical. We're looking at the source material covering professional ethics for medical imaging personnel.
Right.
And this isn't just, reading rules off a page. We want to give you, the listener, a kind of systematic blueprint. How do you become that independent, autonomous, ethically, courageous decision maker when you're actually in the clinic?
It's vital.
Our sources, they lay out everything from the basic language, the core philosophies, the principles for patient care, and maybe most importantly, those practical steps for when you hit an ethical dilemma.
Yeah.
We're aiming to go beyond just ticking boxes, beyond compliance. We're searching for that core understanding, why these standards exist, and crucially, how they're actually enforced.
And it's such a unique field, isn't it?
Yeah.
Because the technical skill, adjusting the machine, positioning the patient, that's visible.
Right.
But the ethical decision-making, that often happens silently, internally. The reality is the imaging professional, the technologist, they're handling incredibly intimate patient data.
Yeah.
And they're delivering energy that can potentially be harmful. That dual responsibility, it means their professional code isn't just a nice to have. It's fundamental to safety and trust.
That sets things up perfectly. In a lot of jobs, the highest bar might just be the law. You follow the law, you're good.
Right.
But here, in medical imaging, it feels like the bar is set much higher, and it's maintained, internally by the profession itself. Okay, let's try and unpack this. We should probably start by just laying out the landscape, the basic terms.
Absolutely. We really have to nail down the vocabulary first.
Yeah.
Because we tend to use words like morals and ethics almost interchangeably in everyday chat. Right?
Yeah, totally.
But in this professional context, they're actually distinct. So morals,
Yeah.
think of those as the generally accepted customs, principles, the habits within a society.
So say like the unwritten rules, what most people think is right or wrong.
It's exactly. They're kind of fluid, maybe inherited standards. What the groups in society accept, it's more internal, maybe even subconscious sometimes. Your gut feeling.
Gotcha. So that's morals. Then what about ethics? How's that different?
Ethics is more formal. It's the systematic study of rightness and wrongness, looking at human conduct, at character. Ethics is really about the system we use to judge whether an action is right. It's the structured framework, the academic discipline almost.
Okay, that makes sense. So if morality is maybe the language of right and wrong we all kind of speak, then ethics is like the grammar, the rules we use to analyze that language properly.
That's a great way to put it, yeah.
And when that analysis, that structured thinking moves into the workplace, into our field, that's when it becomes professional ethics.
Precisely. Professional ethics is the conduct that's publicly displayed, affirmed by the profession itself. It's the behavior written down in things like a code of ethics. And critically, this professional code, it affirms the imaging tech, not just as someone following orders, but as an independent, autonomous, responsible decision maker.
So someone capable of making their own judgments, even if it means pushing back sometimes.
Yes, potentially. Especially if it's necessary for the patient's well-being. The code empowers that autonomy.
Interesting. Now, before we dive into the really heavy stuff, the mandatory rules, our sources mention something called the ethics of care. What's that about?
Yes. And this is really important because it reminds us that being a professional isn't just about being technically perfect or following rules rigidly.
Right. There's a human element.
Exactly. The ethics of care focuses on that. It's a type of ethical reflection that really emphasizes the value of the personal relationship. It highlights virtues like sympathy, empathy, compassion.
So how does that apply to, say, a radiographer?
Well, think about it. You're often dealing with patients who are stressed, scared, maybe in pain.
Sure, kids, trauma patients.
Right. The ethics of care is what bridges that technical procedure, getting the perfect X-ray or scan with genuine human kindness. It affects how you talk to the patient, how you touch them, how you reassure them. And that can directly impact their cooperation.
Which impacts the quality of the image you get.
Absolutely. So it's not just about being nice. It's actually part of providing good clinical care. It connects the tech to the human.
Okay, let's shift gears to the hard rules then. We know what laws are, right? Government regulations, state prosecution if you break them.
Applicable within a political boundary.
And we touched on moral rule, maybe more like personal or societal guidelines.
Segments of right conduct, yeah.
But where does the real power of the profession itself come in? You mentioned the licensing body. the ARRT.
Yes, the American Registry of Radiologic Technologists. And this is where we need to spend a bit of time because it's crucial. The imaging professional operates under state law,
Yeah.
sure, which grants certain legal rights to everyone, but they also operate under the specific enforcement arm of the ARRT. And the ARRT administers its own rules of ethics.
Rules of ethics, not code of ethics. Is there a difference?
A huge difference. And it's fundamental. The Code of Ethics is generally aspirational. It describes the ideals, what professionals should strive for. Think of it as the gold standard.
Okay, like the guiding principles.
Exactly. But the rules of ethics, these are not suggestions. They are mandatory standards of minimally acceptable professional conduct for anyone holding an ARRT certification.
Minimally acceptable, so the absolute baseline.
Yes. And here's the key. They are enforceable. Violating the rules of ethics means the ARRT can and will impose sanctions.
Sanctions like what? A slap on the wrist.
It can be much more serious. We're talking about things like suspension of your certification, or in severe cases, having your certificate permanently revoked, essentially ending your career in the field.
Wow. Okay. So the ARRT really acts like a secondary legal system, but just for the profession.
In a way, yes. It polices the profession internally. And you could, theoretically, comply with all state laws, but still violate the ARRT rules of ethics and lose your certification.
Can you give an example of how that might happen?
Sure. The sources mention mandatory standards. Let's say a technologist becomes aware that a colleague has a serious issue, maybe related to substance abuse that's impacting their work, or perhaps some past misconduct involving patient safety.
Okay.
Rule 14 of the ARRT rules specifically addresses reporting issues like these. Failing to report known misconduct, even if it's uncomfortable, or involves ratting out a colleague, could potentially be a violation of the rules of ethics.
So your professional duty to report, mandated by the ARRT, potentially overrides your loyalty to a coworker or even the department wanting to keep things quiet.
Precisely. It demands a level of self-policing to maintain public trust, which actually ties directly into this idea of a social contract that we'll probably touch on later. The profession promises the public safe, ethical care, and the rules are part of enforcing that promise. #Ch24, #B. The three core ethical theories.
Okay, so we have the mandatory rules, the floor. Now let's look maybe a bit higher at the thinking behind ethical choices. When you're faced with a complex situation, something not explicitly covered by a rule, how do you figure out the right thing to do? Our sources mention three main theories.
Right. Three sort of philosophical engines driving ethical decisions. The first one is called consequentialism.
Consequentialism. Okay, sounds like it focuses on consequences.
Exactly. This theory basically says that the worth, the morality of an action is determined only by its outcome, its ends or consequences.
So the ends justify the means.
That's the classic summary, yeah. If the overall outcome produces more good than bad, then the action that led to it is considered morally right. You weigh the good and bad consequences, and the action is judged by that balance.
That sounds efficient, maybe pragmatic in a busy clinic. Like, say a patient is critical, you need an image now, but getting it means, I don't know, cutting a minor procedural corner, skipping one checklist item because the delay could cost a life. A consequentialist might say, saving the life justifies breaking that small rule.
That would be a likely consequentialist argument, yes. The good consequence, saving a life, outweighs the negative consequence, breaching protocol. But that immediately runs into problems with the second theory.
Which is?
Non-consequentialism. This is pretty much the opposite view.
Okay, so consequences don't matter.
Not primarily. For a non-consequentialist, it's the action itself, not the outcome, that determines right or wrong. Certain actions are seen as inherently right or inherently wrong based on rules, duties, or principles, regardless of what happens as a result.
So in that example, breaking the protocol, even to save a life, would be considered wrong by a non-consequentialist because the act of breaking the rule is inherently wrong.
Potentially, yes. Or at least the justification wouldn't be based on the outcome. It might be based on a duty, like the duty to follow established safety procedures. The focus is on the morality of the act itself.
Wow, okay. So these two theories seem like they're constantly in conflict. Consequentialism, looking at the outcome, maybe aligning with doing good, beneficence, and non-consequentialism, focusing on the action, the rule, the duty, maybe aligning with fidelity, keeping promises, or following rules.
That's a good way to see the tension.
Yeah.
And you can see the problem. If you're purely a consequentialist, you might justify some pretty bad actions if the outcome seems good enough.
Right.
But if you're purely a non-consequentialist, you might rigidly follow a rule, even when it leads to a terrible outcome, failing to act creatively to help someone.
So is there a third way?
Yes, and it's particularly relevant, I think, for healthcare professionals. It's called virtue-based ethics.
Virtue ethics. Okay.
This theory shifts the focus completely. Instead of looking at the consequences, consequentialism, or the action rule, non-consequentialism,
Yeah.
it looks at the agent, the person performing the action.
The character of the person.
Yeah, exactly. Character and virtues form the framework. Virtues are those traits of character that society values, things like honesty, courage, compassion, integrity, fairness.
So a virtue ethicist wouldn't ask what action produces the best result or what rule applies here.
Right. They'd ask something like, what would a good, honest, compassionate, courageous technologist do in this situation? The idea is that if you cultivate these virtues, you'll naturally tend to act ethically.
So it's less about applying a formula and more about being a certain kind of person, developing your moral character.
Precisely. It's about that internal moral structure, which ideally leads to professional excellence that goes way beyond just meeting the minimum mandatory rules. It's about striving to be the best kind of professional you can be.
Okay, we've got the theory swirling around. Now let's bring it down to the ground level, the actual interaction between the imaging professional and the patient. This seems to be governed by a balance, right? Patient rights on one side, professional duties on the other.
Absolutely. It's a dynamic balance.
Yeah.
Hashtag, tag, A rights and self-determination. And in healthcare, the whole concept of rights is just paramount. These are justified claims that an individual, the patient, can make on others, on us, on the institution, on society.
And our sources divide them into legal rights and moral rights.
Yes. And the absolute cornerstone, the foundation of the patient's claim in healthcare is the principle of autonomy.
Autonomy. That word comes up a lot. The sources define it pretty broadly. Self-reliance, independence, liberty, privacy, choice, freedom of will.
Yeah.
The ability to decide for oneself.
It's huge.
How does that actually play out in, say, a radiology department?
Well, the most obvious manifestation is informed consent. Autonomy dictates that the patient must be given understandable information about a procedure, like a complex CT scan with contrast, for instance. They need to know the risks, the benefits, the alternatives.
Okay.
And based on that information, autonomy guarantees their absolute right to refuse that procedure. Even if the doctor, the tech, everyone thinks refusal is a terrible medical decision.
Even if it could save their life.
Even then, their right to decide for themselves, their bodily integrity, generally trumps our desire to help, medically speaking. This aligns directly with rights-based ethics, which really champions the individual.
Which is rooted in that idea of liberal individualism, protecting the individual's sphere of choice.
Exactly. Protecting them and allowing them to pursue their own life projects, which includes making decisions about their own body and health.
But surely that creates tension. Doesn't autonomy sometimes clash directly with the professional's duty to, well, help the patient, to do good?
Oh, constantly. That's probably the core ethical tension in day-to-day healthcare. If a patient refuses something necessary because they're scared or they misunderstood something, or maybe based on misinformation they found online,
Yeah.
the professional is bound by autonomy to respect that refusal. You can't force them. But at the same time, your duty of beneficence, doing good, compels you to try and address the fear or misinformation, to educate them, persuade them, but without crossing the line into coercion. It's a very fine line.
Tricky. And closely tied to autonomy is confidentiality, right? Keeping patient information private.
Absolutely essential. The belief, the professional obligation, really, that health-related information about individuals should not be revealed to others without explicit consent, except in very specific, legally defined circumstances.
And this must be magnified in imaging, where you're not just dealing with lab results or notes, but actual pictures of the inside of someone's body.
Tremendously magnified. That visual evidence of a person's health status or pathology is incredibly sensitive. Protecting that data, ensuring it's only seen by those authorized and necessary for care, is a huge responsibility under confidentiality. Hashtag be an IKEA. Duties and obligations of the professional.
Okay, so we have the patient's rights, primarily autonomy and confidentiality. Now let's flip the coin and look at the professional's duties. The sources call these obligations placed on us because of our interdependence, our role in society.
Right. These are the commitments we implicitly or explicitly make when we take on the professional role, when we accept that certification.
And the sources highlight a few key ones. Let's start with the big two, the sort of twin pillars: beneficence and non-maleficence.
Yes, these are fundamental to almost all healthcare ethics codes. Beneficence is the duty to do good. It's the active promotion of goodness, kindness, charity.
So in imaging, beneficence means Making sure the exam is actually needed, using the right technique,
Yeah.
getting a good quality image that will help with diagnosis.
All of that, yes. Ensuring the procedure provides maximum diagnostic value for the patient's benefit. It's the proactive side trying to help.
Okay. And the non-maleficence sounds like do no harm.
Exactly. It's the ethical principle that places a very high value on avoiding harm to others. Prima non nocere first. Do no harm.
But as we talked about earlier, imaging does involve potential harm, especially with ionizing radiation. How does non-maleficence work there?
It's incredibly complex for imaging professionals. Since radiation is inherently harmful, non-maleficence doesn't mean zero harm is possible. It means you have a profound duty to minimize that harm. This is where practices like the ARRT principle, as low as reasonably achievable, become operationalizations of non-maleficence. Even if ARRT isn't named in this source, the concept is there. Minimize the dose while still achieving the diagnostic goals set by beneficence.
Ah, okay. So those two duties, beneficence and non-maleficence, they're not separate things you do. They're in constant tension, aren't they? You have to balance them.
Every single patient, every single exposure.
If you use a super low dose to minimize harm, non-maleficence, but the image is noisy and non-diagnostic.
Then you failed in your duty of beneficence because you haven't actually helped the patient get a diagnosis. You might even cause harm through delayed or missed diagnosis.
Conversely, if you blast them with radiation to get a perfect picture, maybe overdoing beneficence.
You violated non-maleficence by exposing them to unnecessary risk. It's a constant judgment call, weighing the immediate harm of radiation against the potential future good of an accurate diagnosis.
And this is where having that systematic ethical framework, not just gut instinct, becomes essential for making and defending those complex decisions.
Absolutely critical. It moves it from just a technical problem to an ethical deliberation.
Okay, beyond those two core duties, the sources also list duties that seem more about building trust in the relationship, like fidelity and veracity.
Yes, fidelity means faithfulness. It's about the strict observance of promises and duties. Loyalty.
So doing what you say you're going to do, following through on the care plan, being reliable, being loyal to the patient's interests.
Exactly. It's about dependability and keeping your commitments, both explicit and implicit, to the patient. It builds trust.
And veracity. That sounds like truthfulness.
It is the duty to tell the truth and, importantly, to avoid deception.
This one feels like it could get tricky fast in healthcare.
It can be very tricky. For instance, a technologist's scope of practice usually prohibits them from giving a diagnosis or interpreting images.
Right.
So if a patient looks at you after the scan and asks, "Did you see anything bad? Did you see cancer?" What do you do?
Yeah, what do you do?
Veracity means you can't lie. You can't say everything looks fine if you don't know or even if you suspect something. But you also can't step outside your scope.
So you have to be truthful within your scope.
Exactly. You might say something truthful but limited, like, "My role is to get the best possible images for the radiologist to read. I'll make sure they get these results right away, and the doctor will discuss the findings with you."
Okay, so you're being honest about your role in the process without lying or giving information you're not qualified to give.
Correct. Avoiding deception is key. You don't want to give false reassurance, but you also maintain professional boundaries.
What about errors? If the technologist makes a mistake, wrong patient, wrong exam, maybe a technical error that requires repeating the radiation dose, does veracity demand telling the patient?
That's a huge ethical challenge. Generally, yes, the principle of veracity, combined with patient autonomy, their right to know what happened to their body, points towards disclosure of significant errors.
But that immediately puts veracity in conflict with, well, self-preservation maybe, or even fidelity to your employer, the hospital, who might prefer to handle errors quietly to minimize liability.
Precisely. We're seeing these ethical principles clash again. Veracity versus institutional fidelity. Veracity versus maybe even non-maleficence if you think telling the patient will cause them undue anxiety. These are real dilemmas.
And the last duty mentioned seems to tie it all together: caring.
Yes. Defined here as an emotional commitment to and a willingness to act on behalf of a person with whom a caring relationship exists.
So it's not just performing the duties technically, but doing so with genuine concern and compassion.
Right. It's the attitude, the emotional underpinning that ensures the application of all these rules and principles remains humane. It ensures we remember we're treating a person, not just acquiring an image. It upholds the deeper integrity of the profession.
Okay, this is getting complex. We've got the basic language, these big philosophical theories, and now these specific patient rights and professional duties that are often pulling in different directions. How does a busy professional actually synthesize all this stuff when they're under pressure in the moment? Is there a practical framework? Hashtag tag tag dial A, the frameworks for decision making.
There is. The professional community, especially in healthcare ethics, relies quite heavily on an approach called principlism.
Principlism, based on principles, presumably.
Exactly. It's a belief system, or maybe better, an ethical framework,
Ah,
based on a set of core moral principles that are thought to be embedded in a kind of common morality, widely shared across cultures.
and these principles are the ones we've just been talking about. Autonomy, beneficence, non-maleficence.
Yes, those are usually considered the main ones, often along with justice. Principlism uses these widely accepted moral principles as the basis for analyzing and defending a chosen course of action, especially when resolving an ethical dilemma.
So principle-based ethics is essentially applying principlism.
Correct. Instead of having to go back to square one every time and argue from pure consequentialism or non-consequentialism, which can be paralyzing,
Yeah, sounds exhausting.
right? Principle-based ethics allows the professional to lean on these established principles: autonomy, beneficence, non-maleficence, justice as general, universal guides.
Universal guides. But are they absolute?
Not usually considered absolute. The idea is you respect these principles unless there's a compelling moral reason to override one in a specific situation, often because it conflicts with another principle deemed more important in that context.
Okay, so it provides structure, but still requires judgment. How does justice fit in? We haven't talked much about that one.
Justice in this context is usually about fairness, equitable, fair, or just conduct. In practice, it often relates to the distribution of resources and risks.
Like, who gets the next available MRI slot when there's a long waiting list?
Exactly. Imaging departments often face resource constraints, limited time on scanners, expensive contrast agents, high demand. Justice demands that decisions about allocating these scarce resources should be based on fair criteria like clinical need, urgency, potential benefit.
And not based on things like the patient's insurance status or who they know or whether they're perceived as important.
Precisely. Justice helps ensure fairness in access to care and distribution of burdens. So principlism, using these core principles, gives the professional a more streamlined, practical toolkit for ethical analysis in real-world situations like scheduling conflicts or resource allocation.
But even with these principles, as we've seen, they often clash. One principle points one way, another points the opposite way. That brings us squarely into the idea of the ethical dilemma.
Yes. An ethical dilemma isn't just a difficult decision. It's specifically defined as a situation that requires a moral judgment between two or more equally problem-fraught alternatives.
Equally problem-fraught, meaning there's no perfect answer.
Essentially, yes. It's often a choice between two right courses of action, where fulfilling one moral duty or principle means you inevitably have to sacrifice another one. There are compelling moral reasons for choosing either path, and choosing one means you neglect the other.
Like our example of telling the truth about an error, veracity, versus protecting the institution, or maybe even the patient from distress, fidelity, or non-maleficence.
That's a classic ethical dilemma. Both veracity and fidelity non-maleficence are valid moral duties in that context. You have to weigh them, prioritize them, often based on which serves the patient's overall best interest, and make a difficult choice where some negative consequence is likely unavoidable.
The sources are also careful to distinguish a dilemma from something they call ethical outrage. What's the difference there?
Yeah, that's an important distinction. An ethical outrage isn't a situation with competing valid principles. It's defined as a gross violation of commonly held standards of decency or human rights.
So it's not a tough choice between two rights, it's just clearly wrong.
Exactly. It's an action that falls far below the minimum standards of ethical conduct. For instance, deliberately falsifying patient records, performing unnecessary procedures for profit, discriminating against patients, or flagrantly ignoring safety protocols that lead to harm.
These aren't dilemmas, they're outrages.
There's no real ethical argument for doing them.
Correct. An outrage is a clear breach of fundamental moral principles or rules, like the ARRT rules of ethics. The appropriate response isn't deliberation, it's usually condemnation and reporting.
So understanding this difference helps clarify things. A dilemma requires careful thought, weighing principles. An outrage requires, well, action to stop it or report it.
Yes, and the sources emphasize that deep reflection on moral principles is what helps the professional navigate those murky gray areas of dilemmas and, crucially, helps them recognize and react appropriately when something crosses the line into outright outrage. Hashtag, hashtag, see the broader context. And it's always worth remembering as we discuss these individual decisions that the professional isn't operating in isolation. There's a broader context.
Right, like society's expectations. Exactly. The sources mention the concept of a social contract. This is the idea that there's an implicit relationship between a profession, like medical imaging, and the society it serves.
What does that contract involve?
Basically, society grants the profession a certain amount of autonomy, prestige, and often the privilege of self-regulation, like the ARRT. In return, the profession promises to uphold high standards of competence, ethics, and public service. They promise to use their specialized knowledge for the benefit of society, particularly the patients they care for.
So upholding the code and rules of ethics isn't just an internal professional matter, it's part of fulfilling that promise to the public.
Absolutely. It maintains public trust, which is essential for the profession's continued legitimacy and autonomy.
And then within the profession, there are also internal guides, right? Like personal values and professional manners.
Yes, the individual professional brings their own value system to the job, their personal collection of beliefs about what's important, right, and good. This acts as their internal compass.
Which ideally aligns with the profession's ethical standards.
Hopefully, yes. And this is reinforced by professional etiquette, those generally accepted manners, attitudes, and ways of interacting within the profession. Things like how you speak to colleagues, how you interact with physicians, maintaining a professional demeanor.
So etiquette is maybe less about core moral principles and more about smooth functioning and mutual respect within the team.
Often, yes. While poor etiquette can sometimes have ethical implications, like disrespecting a patient, it's generally considered a separate domain from the core ethical duties like beneficence or justice. But that personal value system, that's critical.
Why is that so critical?
Because, as we said earlier, so much of ethical practice happens when no one is watching. When the technologist is alone in the control room or making a split-second decision during a procedure, it's often their personal commitment to values like honesty, veracity, or preventing harm, non-maleficence, their internal value system that ensures they adhere strictly to the code of ethics, even if cutting a corner might be easier or go unnoticed. It's the ultimate internal control mechanism.
Okay, this brings us to the really practical part. We've got the language, the theories, the principles, the rules, the context. Now, how does an imaging professional actually put all this together when things get complicated, when something potentially goes wrong? Hashtag, tag A, the summary of professional role.
Well, the sources really hammer home the idea that radiologic and imaging sciences professionals are not just button pushers, they are essential healthcare providers.
Right, with a direct duty of care to the patient.
Yes, they owe a concern for the patient's health, their specialized knowledge, their technical skills, and their unique code of ethics all combine to define their professional function within the healthcare system.
And they're often right there at the interface between the patient and the physician, dealing with sensitive information, patient rights, and complex technology.
Exactly. They play this pivotal role, acting as moral agents who have to manage patient interests while operating potentially dangerous equipment. It's a position of significant responsibility.
It really is. That moment where the technical demands of the job and the ethical demands collide must be incredibly high pressure.
It absolutely can be. And to navigate that collision effectively without freezing up or making a poor choice, the professional needs a structured approach. The sources emphasize a specific four-step problem-solving process for ethical analysis.
Okay, a practical toolkit. This sounds like what people need to prevent ethical panic when they're in the hot seat. Hashtag tag B. Navigating the ethical problem-solving process. Let's walk through these 4 steps then, because having a clear process seems crucial, not just for making the decision, but for being able to justify it later if needed.
Definitely. So step 1, identifying the problem. This sounds simple, but it's critical. You have to clearly define the ethical conflict.
Meaning, figure out which principles or duties are actually clashing.
Precisely. You need to articulate the competing moral claims. Is this a conflict between the patient's autonomy and the need for beneficence? Is it veracity versus fidelity to your team or institution? Is justice being compromised? If you can't accurately name the conflicting values, you can't really solve the ethical problem systematically.
Okay, identify the core conflict. What's step 2?
Developing alternative solutions. This requires some brainstorming and critical thinking. You need to lay out all the reasonably possible courses of action,
Even the difficult ones.
especially the difficult ones. This might include options like reporting a colleague's error, admitting your own mistake that will likely trigger an incident report and investigation, refusing to perform an exam you believe is unjustified, or advocating strongly for a patient's wishes, even if it causes friction. You have to consider all viable paths.
Got it. Lay out the options. Step 3.
Selecting the best solution. This is the real analysis part. Here's where principlism really comes into play. You evaluate each alternative solution.
What are you evaluating against?
You weigh the likely consequences of each option, who benefits, who is harmed. You assess each option against the relevant moral principles: autonomy, beneficence, non-maleficence, justice. You check against the mandatory ARRT rules of ethics. And you try to determine which path best upholds the highest professional standards and the patient's best interests, not just the path of least resistance or the one that best protects the institution.
That sounds like the hardest step. It requires real ethical judgment.
It absolutely does. And it leads directly to step 4, defending that solution.
Meaning being able to explain why you chose that path.
Yes. You need to be prepared to articulate the ethical reasoning behind your chosen solution. Why was this option better than the alternatives? How did it appropriately balance the conflicting principles? How does it align with the code and rules of ethics? This justification is crucial, especially if your decision is questioned later. Having gone through the first 3 steps systematically provides the basis for this defense. And the sources give us a really potent case study that pulls all this together. It's the scenario where something has happened, maybe an error, maybe an unexpected adverse event during a procedure, and an incident report is required.
Okay, the moment something goes wrong officially.
Yeah.
Once an incident report is filed, the medical center administration gets involved, right? Risk management, legal.
Exactly. And suddenly, the imaging professional isn't just dealing with the immediate clinical situation or the patient. They're now potentially caught in the middle of a much larger institutional dynamic, often focused on damage control and liability protection.
Yeah, I can see that.
The professional now has to navigate a real tangle of conflicting interests and loyalties. They have a duty to. 1, protect the rights and interests of the patient. This includes their right to know what happened, their right to appropriate follow-up care, and potentially their right to seek compensation if negligence occurred.
Okay, patient first. But what else?
2, there might be pressure, explicit or implicit, to protect the image and reputation of the physicians involved, especially if it was a physician error or order that contributed to the incident.
Loyalty to the doctors, the team.
And 3, there's almost always pressure to protect the medical center administration, the institution itself, from lawsuits, negative publicity, regulatory scrutiny.
Wow, okay. So the professional's loyalty is being pulled hard in potentially 3 different directions. Patient rights versus physician reputation versus hospital liability. And often the path that best protects the institution might involve minimizing the incident, downplaying errors, maybe not being fully transparent with the patient.
That's the crux of the conflict right there. This is the ultimate test of professional ethics. What guides the professional through this minefield?
There has to be a primary principle.
There is. The sources point directly to Principle 5 of the ARRT Code of Ethics, and this principle is crystal clear. It mandates that the professional's primary pledge, their fundamental responsibility, is to act in the best interest of the patient.
Patient interest comes first, period.
Period. So while the professional should act professionally and respectfully towards colleagues and the institution, and should strive to balance conflicting interests where possible, that balance must ultimately tilt decisively in favor of the patient.
So if protecting the institution's reputation conflicts with the patient's right to know the truth about an error,
The patient's right to know, rooted in autonomy and veracity, takes precedence according to the Code of Ethics. If the patient's physical well-being or their other rights are being compromised by institutional protectionism or physician defensiveness, the technologist's ethical duty is clear. Advocate for the patient's interests.
that takes serious guts. That takes that virtue of courage we talked about earlier, and a very strong commitment to veracity, especially when institutional fidelity, or maybe just fear, is screaming at you to keep quiet or fudge the details.
It absolutely requires ethical courage. It requires the professional to remember that social contract we discussed. Their ultimate allegiance isn't to the hospital that signs their paycheck. It's to the public trust and the well-being of the patients they serve. The goal, achieved through that 4-step process, is always to select and be able to defend the solution that best enhances the health outcomes and protects the rights of the patient in their care. that's fulfilling the role of a true moral agent in healthcare. Hashtag outro.
Wow. Okay, this deep dive has really taken us on a journey from, the abstract ideas like consequentialism all the way through the very real, very enforceable art rules and landing right in that high stakes clinical moment where patient rights might clash with administrative pressures.
Hmm.
And that key takeaway, that principle 5, emphasizing the absolute supremacy of the patient's interest, that seems like the anchor in the storm.
It really is. And we saw how the outward display, the professional ethics, the conduct everyone sees, is completely reliant on those internal controls, doesn't it?
Yeah, that personal value system, that ethical courage you mentioned.
Exactly.
Yeah.
Without those strong internal components, the whole ethical structure can potentially fail the moment direct supervision is removed,
Yeah.
or the moment the pressure gets high enough.
Which leads perfectly into our final thought for you, the listener, this week. It draws on that really powerful anonymous quote that was highlighted in our source materials. Knowing what's right doesn't mean much unless you do what's right.
Powerful.
Doing what's right means that is what you do even when no one else is watching. So, thinking about medical imaging specifically, given how technical it is and how often you might actually be alone with the patient or alone in the control room with this complex, powerful machine, how often are you relying solely on your own internal code of ethics, your personal commitment, your articulation of your role responsibility? How often is it just you ensuring the patient's best interests are served, minimizing dose, protecting privacy, ensuring accuracy, especially when maybe no supervisor is physically looking over your shoulder?
That constant reliance on your own internal fortitude, your own professional integrity when no one else is watching, that perhaps is the true essence of professional ethics in this particular field.
Something to definitely think about as you go through your week.